Hi everybody, it's Kenyatta. I wanted to say thank you for subscribing. Thank you for my new subscribers. I actually want to make this a little quick here. I wanted to say hi, thank you. I am having bilateral breast reduction surgery on June the 13th. Today is May 29th. So it's in a couple weeks that I'll be having my breast surgery, and it's because of hydradenitis. I've had surgery in a couple other areas for hydradenitis, and I have a couple more outside of the breast surgery that I have to have done as well. So, anybody who's probably engine searching, they see hydradenitis, they might think they have a touch of it. Just take control, be responsible for what's going on, and seek a physician that knows exactly how to help you. You have hydradenitis, as they tell you, classic textbook, it's underneath your boobs, in your growing area, underneath your stomach, in your armpits. Technically, it can affect any area of where skin overlaps. So, um, that is it basically is folliculitis that gets infected. So folliculitis, you know how you see a little hair bump or something like that. That hair bump that gets a little swollen is the follicle, and the actual swelling up underneath it is the folliculitis. So to say, make sure you find a good family physician that can do examination, because you're going to need them for all the referrals and everything. And then you need a dermatologist, and then you need a plastic surgeon. To say that is because my family doctor put me on topical antibiotics because he didn't know what it was, but he also sent me for mammograms, all kind of things, because the lesions, the lumps were big, especially under my boobs at the time. It was all in my, I mean, my my arms, my boobs, and my stomach and my groin all broke out. Was breaking out constantly. Before I found my family doctor, and that was in 2015 with OSU primary care. So, and once he seen it, he didn't know what it was, and then some of them was hard, some of them was soft. And the first thing he wanted to do is he scheduled me for a dermatology referral, and also go to get a mammogram, because the lesions was just, it was just crazy. So I started off there. Then I got to the dermatologist, and he would inject them, do Botox, do different types of injections to get the lesions to come down. And since then, having the lesions, so they don't get as pronounced in my boobs as they used to, because I still take the oral antibiotics. I'm also on oral antibiotics as well as topical. So anytime I see any areas that start to break out, I'll hurry up and start taking my oral antibiotics. But I use the topical most days, hands down. But like I said, I am 2 weeks here, and I'll be having bilateral breast reduction surgery for hydradenitis. And I'm doing this video because of my anxiety. I never shared to anybody this before. Even with my first surgery, I started doing the videos because I was nervous. With my second surgery, literally my second 2-month post-op, I was scheduling for my armpit surgery. So literally I had it 5 months after I had, not even, probably 4 or 5 months after, 5 months after I had my paniculectomy surgery, because my armpit, I couldn't even put a bra on one day, and I went in the office for my second post-op appointment for my stomach, my paniculectomy. And once he seen it, he was like, "Oh my gosh, you gotta be in so much pain." I was like, "Yes." Can't even wear a bra, can't even do nothing. I have to hold my arm up sometimes, like, it's very uncomfortable, and it's sad to say, as I'm preparing for this bilateral breast reduction surgery. Well, let's go backwards. So one of the stipulations since 2015 was to lose weight to try to get some of the, you know, to control some of the areas where the skin overlaps. But my skin was so stretched out that, and I have no elasticity, that no matter how much weight I lost, the skin was there. It kept it inflamed. To say 2015 to 2017, over a 2 year span, I probably lost 60 to 80 pounds. It was going up and down for a second there. And then when I finally plateaued, I was a total weight loss of 60 pounds, 65 pounds. But it had went down to 80. So totally it went down to a total of 60 pounds. And the day of my paniculectomy surgery, I was under 200 pounds. The day of my right armpit surgery, I weighed 216 because my body retains fluid. I didn't realize it until after my second surgery that my body is retaining fluid, to where I had to take a diuretic to get some of the fluid off of me. So now I'm back. And then I couldn't work out. My arm, my stomach. I mean, I was getting Charlie horses in my stomach to where I had to wait till the connective tissue connected. The tissue that got chopped off got connected, because I would get cramps and spasms right there at the surgery site. So it was like, it was horrible. I couldn't lift too much with my arm because of the nerve damage. It was a journey. It's still a journey with my arm. It's still numb, but I am worried about the hydradenitis. The numbness, I'm tolerating it, and I can get over it. That's why I'm moving forward to now here the bilateral breast reduction surgery. It took me. I've been trying to get this approved for a while, since last October. So I got denied in October. Then I tried to do appeal, got denied in December. And that was with another plastic surgery. So then I had another appointment. I found a new plastic surgeon, only because our schedules conflict. So I found a new plastic surgeon, and he got everything approved. To say now, I'm just waiting. So I want to encourage everybody to take charge of their life. It's very important. Diabetes runs on both sides of my family. I'm not diabetic, but I work in a field where I see where ulcers, diabetic ulcers, and some venous stachys ulcers, and you're not even diabetic, take people's limbs off if they don't protect themselves and take care of themselves. So hydradenitis can get that far. Don't let it. Take control. Seek help. Mine, some people will say, is minor, but it's major to me. I look at other people's, and I've seen my arm get so big, but I've seen it been just little areas, and it goes back and forth to say, it ranges in size. But I've always been the one to try to take care of myself. But it got to the point where being on oral antibiotics, topicals, using this stuff every day is depressing. It's very depressing to know that, to think that you won't get rid of this, or you can't have a life, you can't wear clothes. It's depressing. So it took me a minute, but I'm here, and I just want everybody to know that, take control, take charge. You always want to be greater later. That's my motto. Be greater later. And you don't want to be a elder and somebody has to take care of you, or and they don't want to, or they feel like, oh my God, like you're a burden to them. And it could be just because you have an ulcer, I see a lot of patients that come in and they tell me their spouse will not change it because they don't want to touch it. They're disgusted by it. It's a lot. And just take control now. And that's what I wanted to say about that, as far as taking charge of your life. But I will be doing some more videos. I'll do another one next week, and it's to show, I'm going to try to show some scarring, because like I said, right now I haven't had an outbreak. I got one in my left armpit at this time, and some in my growing areas. I got like 2 on my, and it's all on my left side right now. So, yeah. So, but I'll show you, the pits and the scarring from, under my boobs. I'm gonna try to. I definitely am gonna try to. This is gonna be the. I know in my other videos I didn't even think about it, but it was after the fact that how much I was revealing. But this right here, to do it before at your boobs, is like, okay, this is your private area. Everybody's gonna see you, but I'm gonna do it. I'm gonna try it. I'm gonna get you something so you can see and compare. To videos and different things like that. I did have some things, but I broke my phone, so I took pictures. I did some measurements on my boobs, different things like that I was going to show y'all, but before I can upload them, my phone broke. So I'm going to do those little things over again, for before and after. So once again, everybody, thank you so much. And just remember, sorry, just remember to take charge of your life. Don't let this get you down. I mean, it is depressing, and it will hinder your life. But you have to take charge so you can enjoy your life, and get some peace of mind about, I was saying, the day I get to put on, like, I don't wear shorts. I don't wear, like, you see me in tank tops, but I'm not going out the door with it. No. Because if I have to raise my arm or something, somebody see it, then they can be like, oh my God. So I don't do it. But the day that I'm comfortable, you know what I'm saying? I'm truly comfortable, you know what I'm saying, going outside in shorts and a tank top, it's going to be the day. But thank you again, everybody, and for subscribing, and keep watching, everybody. No matter if you subscribe or not, ask me anything, and I'll promise you I'll try to get the best answer. And if I don't know it, I'll look it up for you. I don't even care if it's about hydronitis. If you feel like you need to talk to somebody, because like I said, it do get depressing to where you just need somebody to talk to. And I tell everybody, the value of a hug or a hi, how you doing, enjoy your day, is the most blessing. It's such a blessing. So just remember to smile at people, say hi, tell them to enjoy their day, talk to them, and like I said, if they're willing to let you give them a hug, give them a hug. Let them know that there is still people that show love in the world. All right, everybody. Y'all have a great evening. All right, bye.